Right. Good morning, everyone, and thank you again for joining. I'm going to continue to let folks in through our waiting room and turn it over to Adrienne to kick us off for the morning.
Great. Thank you so much, Liz. And hello, everyone. We are thrilled to have you at our AmeriCorps 101 session. I think by joining us, you are all part of learning a little bit more about AmeriCorps. We do amazing work, both serving and partnering, and we would consider you all joining us today potential partners, which we're really excited about. Just so you have a little bit of awareness, I think some of you might be aware that AmeriCorps State and National is running some amazing sessions. And then the AmeriCorps 101 sessions are on a rotating basis. And just so that you know, in case you see different faces, if you join another one or have a colleague who does, each of our regions, so we have 8 regions, they're hosting these webinars and they're open to anyone across the US and the territories who would like to join. So really excited about that. I think we probably have an audience from across the US today, which is exciting. I am really excited about Public Health AmeriCorps, which I think is why you are probably here. I have been with AmeriCorps for about a year and 3 months now, and coming from a really big national federal health program. And so I think we have some real opportunities. And I think that we're hoping that you get to see 2 parts of us today, so that you get to hear a little bit from our team about the overview of our agency and the programming and what we do with national service. We couldn't do our work without partners. So that is huge. So that you can kind of see the continuum and where things fit in and how we work. And then the second part of today, we want to really focus on Public Health AmeriCorps, this new notice of funding opportunity in partnership with the Centers for Disease Prevention and Control, CDC. And so we'll spend a little bit of time really walking through some introductory information to get you started. And so with that, I think I'm going to hand it back to Liz to do a poll with us. Thanks, Liz.
Thanks, Adrienne, and good morning again, everyone. My name is Liz Galaz, and I'm a portfolio manager in the Mid-Atlantic region. I'm also a very proud AmeriCorps alum with a program that's based in Philadelphia. So I'm especially excited to talk to you all today about AmeriCorps and share more information about the programs that we have. Just to get us started, as Adrienne mentioned, there have been a lot of different resources out there, especially related to Public Health AmeriCorps, as well as, of course, probably a variety of folks with experience and familiarity with the agency thus far. So we wanted to kind of get started with a poll to better understand our audience today. So I'm going to launch it in Zoom. It should come up now. The first question is multiple choice, so just kind of describing your relationship and familiarity with the program. So feel free to select multiple there. And then the second, I'm really just wondering if folks attended the session yesterday. So we have a kind of a pulse check of how familiar you all are with the Notice of Funding opportunity from Public Health AmeriCorps. Just give it a minute and see. All right, thank you for doing that and for your responses. Looks like we have a great mix of folks who are current grantees and brand new to the agency, and also folks who did and did not attend yesterday. So let's kind of get started. Folks on my team, I would ask if you could please keep an eye on the chat. I would greatly appreciate it as we go through the presentation if questions come up. All right. So as Adrienne shared, the session was developed in response to the Public Health AmeriCorps opportunity, but really we want to provide a general overview of all of our programs so that you can better understand how we might be able to partner together. So we're going to spend the first bit of our presentation talking about what AmeriCorps is and the different programs available. And then we're going to kind of dive in more deeply into AmeriCorps State and National and the new opportunity with Public Health AmeriCorps. So what is AmeriCorps? AmeriCorps is an independent federal grant-making government agency whose mission is to improve lives, strengthen communities, and foster civic participation through service and volunteering. So for over 25 years, AmeriCorps has helped to engage millions of citizens in meeting community and national challenges through service and volunteer action. This slide provides just a high-level overview of some of AmeriCorps' major impact areas that we focus on with our programming through a variety of different avenues. So let's dive right into our programs. This slide provides a quick breakdown of the different programs, and we're going to spend the next few minutes providing an overview of the different AmeriCorps and AmeriCorps Senior programs. So we're not going to go through all of these in detail today, and we'd certainly recommend that you review our website for more detailed information about the various programs and the different benefits that they offer to their members. And we're going to spend most of the time, as I said, focusing on AmeriCorps State, National, and Public Health AmeriCorps. So we will have a Q&A at the end, and wanted to also just highlight that we really would love to partner with you and hope that we can help you find a great fit through one of our programming opportunities. So I'm first going to turn it over to my teammate, Emma Ward, who's a portfolio manager in the Mid-Atlantic region, to share more about what AmeriCorps Vista offers and Triple C.
Thanks, Liz. Good morning and happy Friday, everyone. I'm so pleased to virtually meet everyone. And I also wanted to share that I am an AmeriCorps Vista alum. So let's get started with some more details about this program. So the VISTA program serves in each of the 50 US states and in all US territories. VISTA members serve at local organizations to expand their capacity to make change through capacity building activities such as fundraising, grant writing, research, and volunteer recruitment. AmeriCorps members in the VISTA program serve in an office setting and gain experience and leadership skills. Members are at least 18 years of age. Members serve a full-time one-year term, and members receive a living allowance during their service and an education award or stipend at the end of their service term. That is a brief overview of AmeriCorps Vista. Now I'd like to tell you a little bit more about AmeriCorps and Triple C. AmeriCorps National Civilian Community Corps, which we call NCCC for short, is a full-time service program that covers lodging and travel expenses, allowing young adults to serve on a team and make an impact in communities across the country while gaining valuable leadership skills. Members must be between the ages of 18 and 26. Members can serve a 10 to 12-month term. Members engage in direct service and capacity building. In terms of NCCC FEMA Corps, this program is for young adults who want to gain professional skills in emergency management while serving with the Federal Emergency Management Agency staff on disaster response and recovery efforts. It is a 10-month full-time team-based residential service program. Members serve in a government office or field setting identified by FEMA. Well, that is all that I have time to share about these amazing programs. I'm now going to turn it over to my colleague, Angela Rodriguez, to share more about AmeriCorps Senior. Thank you.
Good morning, everyone, and welcome. Today, I will be presenting on AmeriCorps Senior, and that consists of RSVP, Senior Companion Program, which is SCP, Foster Grandparent Program, FGP. I will start off with the AmeriCorps Senior Companion Program. The AmeriCorps Senior Companion Program pairs thousands of Americans aged 55 and older with organizations making change in communities across the country. AmeriCorps senior volunteers who serve in our RSVP program choose how, where, and when they want to serve with communities ranging from a few hours to 40 hours per week. The Senior Companion Program focuses on providing assistance and friendship to older adults who have difficulty with daily living skills, such as shopping or paying bills. Through this program, AmeriCorps senior volunteers ages 55 plus keep seniors independent longer and provide respite to family caregivers. The Foster Grandparent Program pairs volunteers ages 55 plus with organizations and serve opportunities to mentors and tutor children. Income eligibility volunteers with the Senior Companion and Foster Grandparent programs receive a living stipend. Thank you, and I would like to turn it back to my colleague, Liz, to talk more about AmeriCorps State and National.
Great, thanks, Angela, thanks, Emma. All right, so let's talk more about AmeriCorps State and National. And as we've shared, AmeriCorps State and National is the program that is managing the Public Health AmeriCorps funding opportunity. So recipient organizations, which we refer to as grantees, design activities for AmeriCorps members that demonstrate an evidence-based or evidence-informed approach to strengthening communities and solving community problems. So ASN grants, I should say, we also refer to AmeriCorps State and National commonly as ASN. ASN grants allow organizations to more effectively address community needs by using AmeriCorps resources to support existing programs. So AmeriCorps allows organizations to reach previously underserved communities and expand their activities, but beyond what they were able to do without AmeriCorps. So kind of along the same lines, it's really important to note that AmeriCorps state and national funds cannot be used to duplicate, displace, or supplant resources that already exist in a community. AmeriCorps members or grant funds can help meet unmet needs or can expand an organization's ability to better address community needs, but they take the place of community resources that already exist. AmeriCorps State and National awards grants to nonprofits, local and state government, Indian tribes, and institutions of higher education. And our grant recipients provide opportunities to individuals who we call AmeriCorps members to serve their communities. And since 1994, more than 1 million individuals have provided service as AmeriCorps members. So to talk more about what we're all very excited about and what likely brought you here today, let's dive into Public Health AmeriCorps. Just for some background, I know folks may have seen this previously, but Public Health AmeriCorps is a $400 million 5-year investment utilizing American Rescue Plan or ARP funds. And it's a partnership between AmeriCorps and the Centers for Disease Control and Prevention, which many folks know as the CDC. And there are two key goals of this program. One is around impact, and the other is really around the workforce development for the future of public health professionals. So just to reiterate what's on the slide, the first goal is to help meet public health needs of local communities by providing needed capacity and support in state and local public health settings and advancing more equitable health outcomes for communities who are currently or historically underserved. The second is to provide pathways to good quality public health related careers by providing exposure through on-site experience, training, and more, with a focus on recruiting AmeriCorps members who reflect the communities in which they will serve. So what does a Public Health AmeriCorps members service look like? As we mentioned, this is a brand new program, so there's not really precedent to share or main examples, but we wanted to kind of provide a non-exhaustive list and some suggestions and just awareness around what this could look like based on the Notice of Funding Opportunity, which we'll dive into more a little bit later on in the presentation. So members serving in Public Health AmeriCorps programs will serve in public health departments or in service to public health departments. As I mentioned before, because this is an AmeriCorps state and national program, it's one of our regulations, public health AmeriCorps members will not replace or take the jobs of full-time employees, but rather enhance and help build capacity within their organizations. And it's strongly recommended that AmeriCorps members serving in this program are in at least teams of 2 for both purposes of retention and recruitment, and also the overall AmeriCorps member experience. So as I said, this is a non-exhaustive list of what member service activities could look like. However, I want to just provide some examples that could be helpful while you're thinking through what projects AmeriCorps members could do in your community. And we're really looking to the applicants to share their community needs, then identify what activities exactly will help meet those needs through this program. And should also note, it's really a key agency priority of AmeriCorps is that COVID-19 response, particularly with a focus on equity of access to information, resources, and care, is really something that permeates through all of our initiatives at the moment, of course. So let's move along to talk more about the Notice of Funding Opportunity, which again, there are quite a few acronyms. If you're not familiar with AmeriCorps, we refer to that as the NOFO. So the next few slides, we're going to talk a little bit more about what is in the Notice of Funding Opportunity, or NOFO. As we shared in the beginning, there was a session led by AmeriCorps State and National yesterday that had a bit more detail about the NOFO. We're going to provide similar information today, and also at the end of the session, we'll make sure you're tied into other upcoming training and technical assistance opportunities to learn more. So I could ask one of my teammates to put this link into the chat, but here is the website of where you can locate the Notice of Funding Opportunity and many more, basically all the resources you could possibly need for this opportunity. And you'll see here, this is a website link. The Notice of Funding Opportunity itself is a separate PDF document, which is shown by that first red arrow on the slide. So when you go to the website and you're on the table of contents, you can navigate to go to the funding announcement through that link and then download the NOFO to review it. It's also helpful, wanted to highlight the second red arrow. It's for training and technical assistance information and upcoming webinars. This is where you'll locate all of the registration links, which may be how you found us today, and also other upcoming trainings as well. You'll see on the right there on the screen, and when you go to the website, there is an option to have change the language of the website. Unfortunately, the language change does not adjust the language of the supplemental PDF documents that are linked on this page, just so you know. Before we continue, did want to just make note that this is a competitive application process, which for folks, especially current grantees who might be familiar with AmeriCorps Vista, for example, I just wanted to highlight how AmeriCorps staff roles look different in competitive versus non-competitive application processes. So that doesn't resonate with you, just want to talk a little bit more about what that means exactly. So because it is a competitive process, we're able to share publicly available information, and there might be some questions that we cannot answer due to the nature of the competition. And in those cases, we'll always direct you back to the resources likely linked on this page and through the NOFO, and also to our colleagues in AmeriCorps State and National. And we'll have that contact information at the end of the presentation as well. Okay. So to dive into more specifics around who may apply for this opportunity, the following non-federal entities are eligible to apply: Indian tribes, institutions of higher education, local governments, nonprofit organizations, states and US territories. And another kind of key point here that we wanted to point out is that this opportunity is equally open to folks who are already working with AmeriCorps, new applicants who have not worked with us previously, and organizations that might serve as intermediaries. There are two different types of applicants, both of whom will apply directly to AmeriCorps. So the first is single state applicants. And these are organizations that propose to operate in only one state, as the name suggests. And those organizations will apply in the same manner as national directs. And then if funded, be administered by the governor-appointed state or territory service commission. We will explain what a service commission is as well next, in case you're not familiar with that. The second type of applicant is a national direct applicant. And in that case, it could be a multi-state. So organizations that propose to operate an AmeriCorps program in more than one state or territory, they will also apply directly to AmeriCorps. States and territories without commissions, and there are a few of those to note, and then also federally recognized Indian tribes, and they will also apply directly to AmeriCorps. Okay, so I wanted to include a brief summary of state service commissions for those who may not be familiar. State service commissions are boards of 15 to 25 individuals nominated and appointed by a state's governor. So this appointed board oversees the implementation of national and community service and volunteer initiatives within their particular state or US territory. And those commissions host a portfolio of those single state programs that we were talking about in the previous slide. If you are funded, if you are funded and are only operating in one state, you'll become part of the state service commission's portfolio. And most commissions, just in terms of what the staffing and logistics look like, employ a small professional staff to manage granting, monitoring, and evaluating those single state ASN programs. In addition, state commission staff also often administer special state-specific volunteer initiatives. So again, commissions provide funding to single state ASN programs beyond the Public Health AmeriCorps opportunity through annual grant competitions. And state commissions also provide feedback to ASN on the multi-state programs that are operating within their state. So I'm going to now turn it over to my colleague Annie Dekluski to share more details about the Public Health AmeriCorps NOFO.
Hi, everyone. Good morning. My name is Annie Dekluski. I'm a portfolio manager in the Mid-Atlantic region. I'm also a proud AmeriCorps alum. So we're going to now move on to talk at a high level about AmeriCorps fiscal related terms as outlined in the Notice of Funding Opportunity. Public Health AmeriCorps is a cost reimbursement grant and does not have a match or cost sharing requirement. The maximum amount an applicant can include in the AmeriCorps share of the budget is determined by a calculation that includes the maximum cost per MSY. MSY stands for Member Service Year. So slots and MSY are different. Slots are the amount of time a member commits to serve within a one-year term of service. Each slot has a specific total hours requirement. This breakdown of slots MSY value is included in the Notice of Funding Opportunity and shows the amount of MSY each slot equals. MSY costs do not include childcare or the value of the education award a member might earn. Okay, thanks. So living allowance. Living allowance rates and cost per MSY are not the same thing, although they do kind of read similarly. Cost per MSY is looking at the whole budget. Living allowance rates and living allowance rates are the amount a member is paid during their term of service related to the slot type. A program could have more than one slot type. And also noting a living allowance is only required for full-time members, which is why this is the only slot in the table that is noted with a minimum allowance. Members may not be paid more than the maximum total allowance listed here. And also want to note that your organization, should you be awarded, would administer the living allowance payments to members. Living allowance is not a wage. Recipients can't be paid a living allowance on an hourly basis. Instead, it would be a flat rate that is paid at regular increments, for example, weekly or bi-weekly. The next slide. Thanks. So here are some examples of MSY calculations. So as shown in the table on 2 slides ago, 1 full-time slot equals 1 MSY. And 1 half-time slot equals 0.5 MSY. So if a program wanted to bring on board 10 members to serve in full-time slots, the way that they would calculate the maximum AmeriCorps share of the budget is to multiply 10 times 28,800. 28,800 is the maximum cost per MSY that is available for this funding opportunity. In the next example, you have 20 full-time members and 10 half-time members. So you would multiply 20 times 28,800 plus 5 times 28,800. Also want to note that federal funds requested can also be used for other budget items outside of the living allowance, such as reimbursing, such as paying staff time, personnel fringe benefits, training, and travel costs. Also want to note at this time that the Office of Grant Administration will be hosting a training solely dedicated to budget development, and they will be able to answer. They're going to have a lot of time for question and answer as well. So highly encourage you to attend this session as part of your steps in developing the budget. So we'll share more about that training towards the end of this presentation. So I want to highlight a few resources that are linked in the notice of funding opportunity that could be beneficial as you sort of get your bearings with AmeriCorps State and National. On page 28 of the notice of funding opportunity, there is a link to the current AmeriCorps terms and conditions. You can find additional information about requirements of having an AmeriCorps program. So it goes through a very detailed breakdown of what it looks like to sort of manage an AmeriCorps program. Also on page 28 of the notice of funding opportunity is a link to the National Service Criminal History Check requirements. All AmeriCorps members, as well as staff listed on the budget, must complete National Service Criminal History Check requirements prior to the start of their employment or service with the program. So also encourage you to take a look at these requirements as you consider applying for this opportunity as well. So I'm now going to turn it back over to Liz, who's going to talk more about other resources that are available to you. Thanks.
Thanks, Annie. All right, great. So as we've shared, there are quite a few upcoming training and technical assistance webinars. The link to the website is in the chat, where you can also access the Notice of Funding Opportunity PDF document. Each of these sessions coming up, you'll be able to register just as you did for this one. The links are all on the website. We highly recommend that you attend the next NOFO 101 session, which is Wednesday, October 6th at 3 p.m. Eastern time. The content shared on that call will be the same as what was shared on the first call, which was yesterday, as we referenced in the beginning of our call today. There's also a call on the 12th around performance measures best practices, which, if you are not familiar with AmeriCorps, I highly recommend that you review that before or as you go through your application. And then, as Annie just shared, there's also a session on October 14th around budget development, which our colleagues at the Office of Grant Administration will be leading and will be available to answer your questions regarding budgeting. We haven't highlighted this yet, but also important to note that the deadline to apply for Public Health AmeriCorps is November 8th at 5 p.m. Eastern time. So the timeline is quick, but wanting to make sure that you're aware of all the sessions available to you. There are also on the website, as you'll see, additional 101, AmeriCorps 101 sessions like today's content that'll be hosted weekly for the next 6 weeks. In terms of who to contact, if you're looking for connection points following the session today, you can certainly reach out to the AmeriCorps grants at cns.gov inbox for general questions related to the application and NOFO. We also have our regional staff. Our folks on the call today are from the Mid-Atlantic region, but there are 8 regions across the US and our territories that have staff contacts available to support you in the process. And would certainly recommend that you reach out to those folks if you have more localized questions about programming, et cetera. If you are seeking out Spanish language support, our colleague Christian is available to support guidance through the NOFO as well. So highly recommend that you reach out to him as well. All right, so to kind of close out the presentation portion of the session today, wanted to kind of zoom out a bit and illustrate how communities might use AmeriCorps members and also partner with us, especially for folks on the call today who might be in a bit of a brainstorming space of program development and next steps. So as we've shared, our grantees design programs to meet the most pressing needs in their communities, and wanted to just share some examples on the slide of how communities are utilizing AmeriCorps members and which programs they might be partnering with or they could partner with to meet some of those needs. So I wanted to also quickly bring back Emma and Angela, who are going to share some examples of projects within their portfolios to help further illustrate what it could look like. So Emma, I'll turn it over to you first.
Absolutely. Thanks, Liz. Hi again, everyone. So I'd like to highlight a VISTA grantee in my portfolio that serves a number of communities in Pennsylvania to address health disparities. The grantee has several VISTA members who work on projects connected to healthy futures, and they collaborate with partnering organizations. One of the many accomplishments that I like to highlight is one project that involved investigating and consolidating hospital and midwifery policies on prenatal and postpartum care, labor and delivery, and pediatric visits. Because COVID has so deeply affected birthing mothers' experiences, I can easily see the potential of this project to branch into several areas that could be supported by direct service members to achieve equitable outcomes for communities that are historically underserved. And so I'm hoping that that is helpful for you all as an example, and that maybe some of you listening today are interested in applying or even referring suitable partners. Thank you. And I will turn it over to Angela to share another example.
Oh, thank you, Emma. So I myself, and I do apologize, I didn't mention this earlier. I am a portfolio manager as well in the Mid-Atlantic region. So in reviewing my portfolio, I do have several senior programs, AmeriCorps senior programs that will be a good fit for this new initiative. And I also noticed I do have one project, and this is a perfect example. It's a RSVP project that focuses primarily on healthy futures, disaster services, education, veterans, and families. They have over 600 seniors participating in healthy lifestyle activities, including access information, resources for food, health, nutrition, access, transportation, and medication disposal at health fairs for seniors. Volunteers also provide healthy living phone calls to seniors within the community. So this is also a project or an example that would be a good fit for the public health initiative. Thank you.
Thanks again, Emma. Thanks, Angela. All right, great. Well, now we have the remainder of our call to kind of field some questions. I saw a few already come in through the chat, so we appreciate that. Certainly welcome folks to unmute and ask them aloud as well. You should have the technical capability to do so, but if you don't, please put it in the chat and let me know. As I mentioned in the beginning of the call, since this is a competitive process, we can discuss publicly available information, but there may be some questions that we just cannot answer due to the nature of the competition. But also, we'll certainly link you back to the resources that are available for you to reference, as there are a ton on the website for you to review and likely able to find the answers to your questions as well. We are going to post the slides and recordings for these calls in case that is useful to you, and you're certainly welcome to attend the upcoming AmeriCorps 101 sessions, as well as the other calls led by the AmeriCorps State and National team. Okay, great. Well, we will just pause there, and if folks have any questions, please feel free to jump in.
Hi, Liz. I see one question. I think I see a couple questions related to application like competitiveness and grading. And I want to note that in the notice of funding opportunity, there is a breakdown of points attributed to each section of the application. So there's full transparency in how an application will be reviewed and assessed.
Thanks, Annie.
I also see a question from Christine. Can the requested amount fund the entire Public Health AmeriCorps project? So we would leave this up to you. So we shared the maximum cost per MSY and the calculation there. If as you're working through your budget, you determine that there's more resources or there aren't more resources needed, whether or not, yes or no, that would be up to your discretion in planning the program.
The question that just came in from Randy, I believe, about the limits on the percent of cost per member year to the living allowance versus other costs. We would definitely recommend you attend the budget training and technical assistance webinar to get a response to that directly from the Office of Grant Administration.
Liz, would it be okay, it's Adrienne, to jump in and answer Jessica's question? Okay, perfect. So Jessica, we see your question related to specific examples related to partners and what that might look like. And so I just wanted to note that on that website, on the webpage that has the notice of funding availability and the training and technical assistance, there are also regional contacts listed. And so you're welcome to see what states or territory a particular contact covers, and then you can reach out to them directly, especially if you're looking at a particular area. They might be able to share, what AmeriCorps grantees are currently doing in the area, or connect you to additional information that might be on the website.
And also, Brandy, one quick addition to Liz's response is that information and any information related to requirements around calculations and in the budget, all of that is included in the notice of funding opportunity. So I would take a look there, and then also, as Liz shared too, take advantage of the Office of Grant Administration training as well.
Laura, thanks for that clarification there. So a single state applicant is operating in, the organization is operating in a single state. So certainly your organization might serve in one particular region of the state, one particular city, county, et cetera. And then if you are applying as a multi-state, that is an organization that's serving in multiple states. Hope that helps.
And Laura, you would apply for and describe the program that you would be implementing. So I think this is also outlined. So you would describe your focus area of your program. So if you decide for this opportunity that the program wants to focus statewide, you would include that. If you feel like you would just want to focus on a specific targeted area, you could also include that in your application as well. I think we've responded to all the questions listed in the chat, but if we missed your question, please feel free to add it again or unmute it. We think you're able to and ask the question again. We want to make sure that we don't overlook anyone's questions. Thanks. Brandy, I can provide additional information about the, I guess, definition of multi-state projects. So by multi-state, we mean that members are serving in multiple states. So members would be serving at a service site. So that's the operating site, is the service site where the members are serving, basically the organization that the members are in service to. So if an organization is in one state and has members maybe serving in that state, as well as another maybe 3 states around there. So for example, I'm in New Jersey. So maybe there's an organization that is in New Jersey, but is also serving programs or projects or service sites, their service recipients in Pennsylvania, New York, and Delaware. That would be considered a multi-state project because members are serving organizations and serving at organizations in multiple states. Does that help? And don't apologize for so many questions. We love questions. Thanks.
Yeah, and I'll add to, AmeriCorps members are not able to supervise other AmeriCorps members. So just to keep that in mind as well.
And also there's additional information about supervision requirements in the terms and conditions that are linked in the NOFO. So that could give more information related to oversight and the requirements there.
Thanks for your question, Brandy. Adrienne, would you be able to speak to the in service to public health departments as opposed to working directly at a public health department site question?
Sure. Yeah, thanks. And thanks, Brandy, for popping it back in the chat. That's so helpful. So I think we really want to be able to support local community needs. And so that's important to both us at AmeriCorps and also CDC. And so for that reason, there is some broad language related to in service to public health. So departments. So folks could be physically at public health departments. So I think of my local county health department. They do a lot of different things. They do nutrition and education and maternal and child health and all different other things. And so someone could physically be based there working with those programs. They do dental health too. Or there could be the ability for folks to work at a community organization. So we know that nonprofits are eligible entities under the NOFO. And so someone could be at a nonprofit organization that perhaps is doing community health work. So one of the first organizations that I worked in coming out of college was a nonprofit organization. They worked with the immigrant community, and they had public health type work happening and education and different other things. And so someone could be, at that agency, that nonprofit agency. I think it is important to us that there is an element of coordination, definitely because we want to make sure that we're meeting the needs in local communities, and not that we don't know the needs, but it's good for us to kind of have that level of coordination. And so knowing what the health department's working on and what their needs are, and doing that in collaboration, whether that's communicating and understanding their plan, or on the back end applying, but being able to also make that connection, knowing that folks are definitely very, very busy at that time, at the time right now, is important. So in service to public health departments doesn't mean that someone has to physically be at a public health department, but in a setting where they would be adding value to public health within their community, and then also thinking about who are the eligible applicants under the notice of funding availability and what does that look like. I also wanted to highlight something a little bit earlier on. It wasn't a question, but when we were talking about what organizations are eligible, I think you saw that existing organizations that work with AmeriCorps could be eligible, as well as brand new organizations, new partners to us. We would love to have that happen. And then there was this word on the slide that said intermediary. And so I want to talk through that a little bit. We also anticipate that there might be organizations who have capacity to work with other organizations. And so if an organization would be in that position, maybe they're applying in multiple states, being able to talk through that, I think, is definitely a possibility. So if you had more questions about what it means to be an intermediary, or if there are potential organizations that you could just get some contact information to, that would be a great place to tap into those regional contacts on our website. Or you can email us directly, and we can try to get you linked in. I think we know that there are a lot of smaller communities who have needs, and the role of intermediary can also be super helpful in the work that we do together. All right, thank you.
Hi, Andrea. I see your question regarding applicants applying to this public health notice of funding opportunity, and also applying to the AmeriCorps competitive notice of funding opportunity. So an organization can submit multiple applications, and also if you're maybe a large organization that has multiple kind of focus areas, you could host more than one AmeriCorps program. So one AmeriCorps program that's maybe public health focused, maybe one AmeriCorps program that's focused on environmental stewardship or education. So you could host two very separate and distinct programs simultaneously. Or if you are hoping to submit a same program model through multiple applications, you could submit multiple applications. However, the funding would only be, we wouldn't fund the same program multiple times, if that makes sense. The same program as in the same organization with the same program model through multiple, yeah, we wouldn't fund it multiple times.
So Amy, can I ask a quick clarifying question? So
sure.
If I'm a nonprofit and I decided that I was really interested in doing public health with seniors, and if there were an opportunity, I would apply to AmeriCorps seniors to do something, but that same program is the program that I'm also applying to Public Health AmeriCorps for. I couldn't like get double funding to do the same program. Is that right?
Right. And something to note too, if you're thinking, maybe you already have an AmeriCorps seniors program that supports public health broadly. You could also have an AmeriCorps state and national program that also supports public health. That the members could not supervise each other in any way, but they could also work in tandem towards the same goal. Basically, they would have different roles, but work together to achieve this broader goal.
Annie, I think that's super helpful to me too, thinking about like AmeriCorps Vista, where AmeriCorps Vista does a lot with capacity building, and maybe an AmeriCorps Vista sponsor right now, to Emma's example, and I'm working in public health, maybe related to capacity building, and a good fit for me to have to be able to continue our work is having this element of the direct service component that I could apply for through Public Health AmeriCorps, and then maybe my Vista can work with my Public Health AmeriCorps members, again, not supervising, but having some collaboration to help us continue to meet community need. Awesome.
Nicole, I'm wondering if your question is related to eligibility. States are listed as one of the eligible applicants for this funding opportunity. I wonder if your question might be related to being the same sort of this within the same department of state government, and I am not sure of the answer to your question. So I would encourage you to reach out to AmeriCorps grants at cns.gov. I'll drop that into the chat.
Thank you all so much for your questions and for the activity in the chat. We have about 4 minutes left, so we'll definitely stay on the line to answer any other questions that come in. Yes, and thank you to Adrienne's point. We're so grateful that you joined us today. And if you are hopping off, please feel free to reach out to the folks who are listed on the Public Health AmeriCorps website. And we would love to connect with you further about our programming. Nicole, do we know if the Q&A on the NOFA will be posted on the website? I am not quite sure. Does anyone on the team know the answer to that?
So Nicole, I think to your question, and thanks for asking it, I think these sessions for AmeriCorps 101, we probably won't post them on the website, but we do anticipate that a recording of the AmeriCorps state and national webinars will be included. And I think in addition to that, there would be the transcript. So there would be the ability to go back and look through information. And we definitely, I mean, this is an active process. So as we're getting new questions, we're continuing to look at them together and to be able to understand and see if there's additional information that we can embed into content as we're continuing to provide information. I think that is a slight plug for joining the second AmeriCorps State and National 101 NOFO session, because we do anticipate that folks might be a little further along in their application around October 6th when that session is live. And so if you have additional questions after that, that would be a great place to be able to bring them as you're continuing to kind of delve into the application process.
Yes, thanks, Adrian. I know yesterday our colleagues in AmeriCorps State and National said that they were taking note of the questions that came up and they would make sure to incorporate their responses into upcoming sessions too.